Good afternoon, everyone. I'm Mohamed Abaji from the Washington University School of Public Health, and welcome to Kenneth Cole in Conversation with Dean Sandro Galea. We're happy to have you here with us in person, and I'd also like to extend a warm welcome to our online audience. We have over 500 people joining us from around the world. Thank you very much. And I think this is the right cue for my housekeeping notes. We please encourage you to silence your mobile devices, and do know that this event is being live streamed and recorded for educational purposes. For our online participants, we encourage you to engage with us using the chat function, and we'll try to incorporate your questions as much as we can into the Q&A. After the event, there would be a reception here at the Clark Fox lobby. And before we start, we want to start you with a trailer of the documentary film, A Man with a Soul, The Impact of Kenneth Cole. The film is directed by the multi-award winning director and producer, Dori Beristain, who is also here with us today. The film has been featured at several film festivals, and it will be the opening night film of the St. Louis International Film Festival this evening by 7:30 p.m. at High Point. So before I invite Stephanie Kutzman to offer the opening remarks, can I please ask you to turn your attention to the screen for the trailer of Kenneth Cole, A Man with a Soul.
In business, there was no book, especially the fashion business. You write your own every day.
Kenneth Cole made a spectacular splash into the glitzy world of high fashion in 1982.
He's not one of the designers who started out doing high-end couture.
I had no money. I knew I was going to figure it out.
Kenneth was a natural-born showman and a natural-born salesman.
The company was on fire.
He's the punmeister of all punmeisters,
who grabs our attention as much by his words as by his designs.
It's part of the DNA of the company.
In those days, there was this new, ominous black cloud that was looming over. I watched Associate David in the office died of AIDS. It was a tipping point moment for me.
He started to integrate this cause into his business.
The ads that he put out there were shocking.
Do you worry about alienating customers as you make your political statements?
People rant and rave and tell me, what the hell do I know?
He contributed his marketing genius.
Launched a series of provocative advertising campaigns.
He highlighted, look at what we're doing. Look at us as a society.
I was inspired by a lot of people, but maybe none more than my wife, Maria.
You have to be willing to get negative response, and sometimes it affects your bottom line.
There are more regulations on teddy bears than there are on handguns.
Some feel he's taking it too far.
Just say don't buy the shoes.
He's doing what he's doing in social impact, not because it's good for his business, it's because it's good.
Fashion icon and social activist.
Kenneth Cole.
For me, it's not just what you stand in, but what you stand for.
There's no chance that anytime soon Kenneth Cole will be quiet.
I don't do quiet easily.
That was such a powerful film trailer, and certainly reminds us why we're gathered here today and why the conversation we're about to have matters so deeply. We'll be showing the film in its entirety here on campus on November 17th, but today we have the opportunity to hear directly from the man with soul. Good afternoon. My name is Stephanie Kutzman, and I'm delighted to welcome you to this forward-looking fireside chat featuring Kenneth Cole in conversation with Dean Sandro Galea. As Executive Director of the Gephardt Institute for Civic and Community Engagement here on campus, I'm thrilled to see this event come to fruition in collaboration with Mr. Cole and his visionary team. His lifelong commitment to leveraging business and creativity as vehicles for social impact exemplifies the Gephardt Institute's vision that WashU graduates are prepared and committed to leading civic impact wherever they live and work throughout their lives. Before I invite Mr. Cole and Dean Galea forward, I'd like to take a moment to thank the School of Public Health team for putting together this incredible conversation. The thoughtfulness and care that has gone into today's event reflects the school's commitment to bringing together diverse voices to address our most pressing health challenges. The Gephardt Institute has been honored to collaborate with the School of Public Health, Olin Business School, and the Sam Fox School of Design and Visual Arts to bring this conversation and our film screening on November 17th to the WashU community. I'm also pleased to recognize Dory Berenstein, director and producer of this new film, A Man with Soul. Dory is a 6-time Tony-winning Broadway producer and an Emmy Award-winning director and producer, and we're honored to welcome her to campus. And finally, I'd like to extend my thanks to Mary and Jim Mosbacher, who introduced us to Kenneth Cole and Dory Berenstein and inspired us to seize the opportunity to host them on campus while they're here for the St. Louis International Film Festival, where A Man with Soul will be featured tonight. For those who may not know, Kenneth Cole has spent decades demonstrating that business and social impact are not just compatible, they can be mutually reinforcing. From his groundbreaking work in AIDS advocacy during a time when few were willing to speak up, to his current leadership co-founding the Mental Health Coalition, Mr. Cole has consistently showed us that platforms of influence come with responsibility and opportunity. His work sits at a critical intersection that we at WashU care deeply about. How do we bring together business, advocacy, and public health to create meaningful change? How do we reduce stigma, reach communities, and drive action on the mental health challenges facing our students and society? Moderating this conversation is Dean Sandro Galea, whose scholarship and leadership have transformed how we understand population health. When Dean Galea established the Washington University School of Public Health earlier this year, the vision was clear: to build not simply a new institution, but a new kind of school, one that reimagines what public health can be and how it can act in the world. This vision is guided by the school's 4x4 plan, 4 strategies, and 4 new directions that together define our path forward. At the heart of this approach is the recognition that we cannot solve our most pressing health challenges, including mental health, in isolation. We need partnerships, we need innovation, and we need leaders willing to work across traditional boundaries. Dean Galea's work has consistently challenged us to look beyond individual interventions and ask the bigger questions. What are the root causes of health inequities? How do we create systems that support mental health at scale? And critically, how do we bring diverse sectors together to create lasting change? Today's conversation brings together 2 such leaders, one from business and advocacy, one from public health and academia, to explore how cross-sector collaboration can drive real impact for the mental health challenges facing our communities and students. Please join me in welcoming Dean Sandro Galea and Kenneth Cole.
Good afternoon, everybody, and thank you for joining us, and thank you for that kind introduction. Thank you for joining us in person and on Zoom. So we're going to talk a little bit, Ken and I, for about 30 minutes, and then we'll have time for audience questions, both in person and on Zoom. So, Kenneth, first of all, welcome. It's great to have you here. You need to, yeah.
It is an honor to be here.
Thank you. So let me start. Let's dive right in. Let's start with a bit of a personal question. So you've worked on HIV, mental health, homelessness, gun violence, and these problems can crush the spirit if you let them. So what keeps you going? What keeps you going after 40 years? What gets you up in the morning?
You know, I have this, I've been afforded this platform, which makes everything I do more meaningful. And the more you stay and dedicated and committed to this process, the bigger everything seems to be at the end of the day. I've always believed that it's almost impossible today to be in the fashion business for an extended period of time, because there's all these forces that are in conflict with each other. And I do think that and you struggle because you can't do anything today in 40 hours a week. You've got to make certain compromises. And I think at the end of the day, I came to realize that this needs to be about something bigger than what it is in the ordinary course. It can't just be about making money. And it can't just be about, and you can't do that in just 40 hours a week. And I realized if I can make this part of something bigger than it is in the ordinary course, then everything gets bigger and easier. And I started down this road early, and it was, as far as building a sustainable business, you can't nail the heel heights and hem lengths every season. You're going to miss, and you're going to have implications of that. But I came to realize that if I can make what I do part of more about not what you stand in, but what you stand for, not just what's on your body, but what's on your mind, which ultimately influences what's on your body, then I create a more meaningful relationship with the customer and a more sustainable business.
So let me ask you a question I'm curious about. So, you're a celebrity, so I presume most dinner parties you go to, everybody knows who you are. But if you were to go to a dinner party where people don't know who you are, how do you introduce yourself? Are you a fashion designer, an activist? What do you say you are?
I don't believe that what you do is who you are. So, and if somebody says, and I won't usually say, what do you do to somebody, because I think that demeans and diminishes the conversation and the relationship. But I do think that I'm a caring member of the community, and I spend a lot of time in the fashion business, and I seize every opportunity to make an impact, a social impact, philanthropic impact, where I can. And I've dedicated and focused our resources. I feel you could be more effective if you do that. And I did an AIDS campaign in the early 80s. We started talking about it when few were, and most wouldn't, and arguably shouldn't. And and all of a sudden it changed the man, changed the brand, changed the company, and everything became more meaningful. And and then I stayed that course, and I was afforded more and more opportunities to have an even bigger voice and a bigger platform and affect it in more meaningful ways. So I stayed that course.
So let me pick up on what you just said. You said, it changed the course. So you started off, you're a shoe designer, and then the movie, which is terrific, I really enjoyed it, with congratulations to Dory Bernstein, who directed it. You chose to do this. I mean, you could have stayed a designer, shoes, clothes, etc., but you dove into this field of activism. So that takes courage. It takes audacity. Like, where did that come from? Where did it come from that you could say, you know what, I am going to make a difference in this other sphere?
It didn't start there. It started, initially it was a thoughtful business decision, and then it became a very personal one afterwards. And it's a course that I have been relentless on, and I do feel it makes everything I do bigger than it is, and more meaningful, and more relevant. In the fashion business, you need it's all about viability and relevance. And as I said a few minutes ago, it's hard to do that with fashion consistently, and it's hard to hit all the trends in the right way, at the right price, geographically and physically and aesthetically. But again, if I can make the brand, more significant, more meaningful in other ways, and then I realized everything felt more important. Every one of my associates felt better about being where they were. And what we uniquely did, and it's a story that Dory tells brilliantly in the film, and it wasn't the story I thought she was going to tell. She asked if I would be okay doing this film, and I thought she was going to tell it more of a fashion story, but it ends up being a story about social impact, and it's how the cause and commerce together create something greater than the sum of its parts. And every associate touches it in a different way. It's not, social impact isn't what we
do, it's part of who we are. And it's not, a corner office and a singular discipline. It's embedded into the entire business model. And then we also have a not-for-profit in the office, in the building. It's, again, the Mental Health Coalition. It's a 501c3, and there's a handful of people that work only for it, and they have very clear, quantifiable goals, objectives that they're held accountable for. And at the end of the day, they're making a difference. They're making a quantifiable, transparent difference, and they go home every night, feel better about what they're doing and the impact they're making.
It is particularly refreshing at this moment in time to hear cause and commerce go together at a time when one can't help but feel we're seeing the rise of commerce at the expense of cause throughout the entire ecosystem that we live in.
I think all businesses ultimately figure this out. We all watched what happened with the SNAP grants this week and how all of a sudden it dried up. And all these people that were so dependent upon government funding. And we've come to realize that unless business figures out how to support the community that support the hand that feeds it, the proverbial hand that feeds it, it's not sustainable. And I think, and I do think every business gets there. Every business figures it out. And if their hearts don't get them there, their balance sheet does. And hopefully it's the former. But I think everybody figures it out eventually and then business and supports the community. I think academia finds its way there in different ways.
But I think you're underselling how much courage it takes.
You say it's courage. I don't know that it's courage as much as it is viability and opportunity. And you realize if you can do it a certain way and make an impact that you can uniquely, then you do it, and you do it with all you've got. And again, it makes everything more meaningful.
Let's watch a clip about sort of what really you were doing. Let's roll with clip 1.
So the concept is to draw upon the resources that exist, the passions, the inspiration, the access, and figure out how to make 1 + 1 + 1 = 10.
And the idea was that a few of these individuals who were in the ad would show up in different places a day or two before the actual unveiling with T-shirts that said, "I have AIDS." And the press would challenge it quickly. How long, to what degree? And then they would be silent, and then we'd all stand united on World AIDS Day with the message that we all have AIDS.
If one of us have it, we all have it. That this is no longer a separation, that we are in the fight of our lives.
It feels very personal to me. Still losing friends.
If we don't have it medically, we have it socially, we have it culturally, but we're all affected, even if we're not infected.
The We All Have AIDS campaign, I expect and anticipate will be the largest public service campaign addressing stigma in the history of the disease.
It's hard today to even remember how important this was when it came out. When this came out, I was a doctor caring for AIDS patients, and this was really important. So to tell us a little bit, what I think was brilliant here is that you realized that stigma was the key. That stigma was the key that brings people together. That's actually, it's an abstract concept around which to bring people around. To tell us how you came to that. How did you come to see that this is what was needed at that time?
So I was chairman of AMFAR, and AMFAR was the largest AIDS research organization, private research organization, probably in the world at the time. And then first people, and you're probably going to ask me, so I'll just head it off. So what qualified me to be the head of a research organization? I'm not a psychiatrist. I'm not a public health expert. I'm not a doctor. I have no medical qualifications. But I do feel that stigma is about perception, and I am in the perception business. And I do think that I can tell that story uniquely from a different point of view. That was the collective wisdom of the board, who insisted I take on this responsibility. So I was chairman of AMFAR for 15 years, and I do believe at AMFAR we maybe millions of people are alive that wouldn't have been otherwise, and we creatively addressed how research was done, where it was done, to the degree it was done, And we're at every advocacy table. We were where decisions were made. But I would say then, I say today, I'm usually the least qualified person at every table I sit at. But we had very clear goals and objectives. And I forgot your question.
Well, there was a fine answer to my question. Let me ask you perhaps a harder question, because to be able to do what you've done and to align commerce and cause, as you said, you clearly have a Six Sigma talent for aligning people with what you want to do. But even then, you must have faced resistance. It cannot have been that your board came along. It cannot have been that the business always benefited from this. These things cannot all have been aligned all the time. So talk us about the hard stuff. Talk to us about the resistance you faced. Talk to us about how you dealt with that.
It was a little easier in those days. You didn't have social media, and you didn't have to confront alternative points of view at will. But I do think that there was a very inspired audience. The AIDS community was profound, and it was everywhere. But everybody was focused on research, on treatment, on care. But what was so devastating ultimately was living with the virus, which had its roots in how you were perceived in the community, and people, to the degree you openly addressed your status, then you stood to lose friends, family, community. And so very often people didn't. In South Africa, I also accepted a position as UNAIDS ambassador for, and I travel to places and people would not get tested, and they would not avail themselves to treatments which were available because they did not want to be known to be, their status to be of public record. And and that's just, again, public perception. And so if we could affect that, we could affect people's lives, and which is ultimately takes us to the mental health stuff we're doing today.
So, the movie is,
also, by the way, what I found out to be the common denominator. We had all these great individuals, very public people who had committed all their resources, their celebrity, to making a difference, because people were so impacted by the devastation of this virus, which arguably, by the way, was much worse than COVID. COVID was more contagious, but it wasn't as lethal as AIDS was. And arguably today, mental health is maybe even more lethal because more people are taking their own lives and dying in different ways. But AIDS was and remains a real crisis. And so it was an opportunity that seemed and I had the privilege of playing an important role and looking at it uniquely.
So the movie is a really compelling portrait of someone who knows exactly what they're doing. I'm sure it didn't always feel like that, but the movie, I think, does a really nice job of capturing you, pushing through, and actually making a real difference. But I thought the movie was most powerful when it talks about a message that landed in a way you did not intend, and that. Not the triumph, but that mistake. Let's watch that clip. Second.
Of course, the gun issue, which is a significant, very courageous campaign of Kenneth Cole.
Gun safety has long been an issue that Kenneth Cole has stood for.
Now, I can see it on your shirt. We were just talking about it. Tell me about the bigger issue. You tie your fashion shows with something else.
There are more federal regulations on teddy bears than there are on handguns. Also, last weekend, the whole country was an uproar because 2 people were killed by sharks. The same weekend, 250 people were killed by handguns.
Issues like that, gun safety, gun control, whatever you want to call it, it's so polarizing.
How do you summarize the complexity of the gun problem?
Today they do shooting
drills with young kids in these young schools. It's frightening. And they have metal detectors when you walk through the doors of these houses of learning.
We ran a billboard on the West Side Highway, which was very transformative in certain ways for us, and it said 40 million people in America live with mental illness. Some can access treatment, all can access guns. And the message was meant to say there's not enough access to mental health treatment, but there's too much access to guns.
Your sign is a lie. I know you wish it wasn't so you could push your agenda, but I'm here to call you out.
So what happened in the 24 hours after that billboard went out? Lead us through it.
So social media started to be a force, because it's a little bit later on in our journey. And so the message was, look, people, I always believe people have very short attention spans. And I think everybody has ADD. It's either clinically determined and or socially imposed. But the goal was, how do you say as much as you can in as few words as possible? So the goal was, how do we address this complexity? And Maria was on the board of the Brady campaign at the time, my wife, and we had worked with them for years. And and I felt that this somewhat summarized it, because they were attributing a lot of this to people with mental illness. And it somewhat captured it, but it alienated certain people, and they were very vocal about it. And social media gives them the platform they didn't have before. So it forced me to think long and hard about it, and I understood the issue, and I figured, maybe I can address this more thoughtfully. And so we ended up allocating much of our resources. I had just stepped back from our work with HIV at the time, and NAMI had come to us and said, why don't you do a campaign about the stigma in relationship to mental illness? 1 in 200 people today live with AIDS. 1 in 4 live with are or will be living with mental health conditions. And then we came to realize it was 4 out of 4, because if it isn't you, it's somebody you love, or somebody in the family or the community. But this was a real crisis, and this was way bigger than we were. But they says, well, do it. We spoke to the board. We'll give you support. If you could do what you did with HIV, with mental health. And I said, but this is so much bigger than NAMI. They says, well, then bring in everybody. So we systematically reached out to the 50 largest mental health service providers, all speaking to disproportionately impacted communities, all of whom essentially said yes. And so now we built this coalition, and we tried to, with the understanding that there are more needs than are imaginable, and there are limited resources. But if we can somehow connect the needs to resources, we can create, creatively, thoughtfully, we can create a real meaningful impact. So we kind of pivoted, refocused our efforts, and now we're doing some great work, which we can talk about if we have time, but hopefully I do think we can change. And mental health, I've also come to realize, is basically has its roots in every social ill. Today, criminal justice, homelessness, all public health issues, ultimately mental health is a factor at some level in all of them.
So you anticipate my question, because my read is that you came to see mental health as being at the root of a lot of these other challenges that you were dealing with, something which I agree with you completely. So what had you learned in your HIV activism that then you were able to apply to mental health? How was that transition for you? How were you perhaps even better at dealing with mental health?
The power of stigma, they don't teach you this in medical school, and they don't teach you this, in your traditional, I don't know about here at WashU, but it's not part of the curriculum, and people don't, how do you deal with the perception often precedes reality or determines reality. And so you had all these great minds and these great forces, but the common denominator in every case is stigma. And that's what brings everybody together. And we have a nation today that's totally polarized. And I don't think we're paralyzed, but we're polarized. So, but I think a lot of that is because everybody is fed a different narrative by their unique algorithms. and everybody's source of news is unique to them alone, and they form their own opinions, and it's very hard to change their course. So that's probably a different answer to your question.
No, there's an answer to an adjacent question. That's all right. Let me shift a little bit. I want to talk a little bit about science and intersection of science and business. Let's watch the third clip.
What has made HIV a success story in terms of advancing antiretrovirals and advancing programs that take care of, in a holistic way, not just the physical well-being, but the mental well-being of an individual living with HIV, was partnerships. Partnership between the scientific enterprise and then individuals who were completely unassociated with the scientific enterprise, and that's the entertainment industry, people like Kenneth Cole.
When I had originally run my first AIDS ad, and I had originally joined the board of AMFOR, there were probably 18 AIDS organizations in America at the time.
So you go on to say there were 18 AIDS organizations, but then there were 2,000, all with the biggest hearts but tripping over each other. So how did you actually create unity when you have 2,000 tripping over each other?
Well, I think you create a forum where they talk to each other, where they can talk to each other. And we brought all these communities, all these AIDS or mental health organizations together. And they had most of them had never met each other, and they were never at the same table together. And there are so many needs and opportunities. But again, as I started to say, with the biggest of hearts and best of intentions, everybody's tripping over each other. But if you can identify the opportunities, at the same time, the obstacles, you can more efficiently allocate resources and make a significantly and unprecedented impact time and time again. And people, and just stigma isn't, or in the ordinary course, isn't anticipated, it isn't trained, isn't taught. And so these organizations grasp onto that. If they all realize it's a problem, and they're all appreciative to be able to be part of the conversation.
So I'm particularly interested in tensions and challenges, because I think sometimes, particularly if we have students listening or people earlier in their career and life stage, they see you and they think you've achieved all these things. It must have been easy. So there are moments, several moments in the movie where you talk about when it was difficult, and I just want to focus on one moment where you say, as a public company, I couldn't do what I needed to do. When you talk about some of the challenges, you have this business, family dependent on it, many employees, their families depend on it, and the challenges with being a public owner and being an activist, being an owner of a public company and being an activist. Talk us through that. Talk us through those tensions, those challenges, how you found the way forward, and what was the way forward, and if you're willing to share, compromises made.
So we were a public company for 20 years. And traded on the New York Stock Exchange, was KCP, Kenneth Cole Productions. And then at a certain point I realized, and now very often at shareholder meetings, annual shareholder meetings, I'd get the question, well, do you think, is it okay for you to be spending shareholder dollars on your personal agenda and on these social issues, political issues? And I would answer, nothing I talk about is political. These are public health issues. The human rights issues, maybe social justice issues, maybe, many of which have been politicized, but they're not political issues. And I was doing this before you bought the shares, and I'll be doing them after you sell it. So it's who we are, it's who the brand is, it's who I am as the chairman of the company, and that's just not going to change. So I stayed that course. Everybody's second guessing themselves now because in the new administration, there's a whole kind of new challenge on DEI and all these other issues that we had made so much progress on. And but we're staying on course. This is who we are, is what I believe in. This is what we do, and we may change some of the words we use, but we're not going to change what we stand for and the course that we take. I'm still trying to remember your question.
That's all right. I'm going to ask you two more questions. And then we're going to get questions from the audience. So I'm teeing up the audience for you to get ready to your questions. So let me start with something which I really admired in the movie. So you're pretty honest. I mean, you say, there's a quote, you mentioned it was calculated somewhat at the beginning, but became personal quickly. And I really admired it. I admired the fact you're honest about the calculation and strategy, and then, of course, the personal commitment. But I think sometimes we're queasy about being honest about our motivation. So talk us a little bit about, do you think it's okay to be calculated to do good? Does that somehow diminish the good?
Well, my job is to be calculating. I'm the chairman of the public company. We have a relatively large business at the time. Thank to a large degree to Gene Kahn, who was sitting here, who was probably our largest customer at the time. And we built a great business. So my job is to serve the business. And I do believe that, there's three filters in the company. We put everything through those three filters. One is agility, relevance, and profitability. So if it's not profitable, we can't go down that road. And that enables everything else that we do. And does it keep us relevant? Because that's critical. Otherwise, we're not going to have an audience. We're not going to be able to resonate. And do we have the ability to pivot? Because the world is changing faster than anybody can imagine. And as crazy as it's been with social media, now with AI, it's unfathomable. I mean, you can't even plan where you're going to be in a few years from now, because we don't have the ability to even anticipate the change that's ahead of us.
My last question, then I'm going to open up to the
But it's changed me, and it's so much more rewarding. And I do believe our retention rate in our company is 2 to 3 times anybody else in our industry. And it's because everybody feels like they're part of something bigger than they are.
I can't tell you how often I've been in conversations with colleagues and friends in the private sector to make that argument, and how reluctant people are to embrace what you embrace.
But the argument that gets them there, we have an initiative every year that in New York, it's called Wellbeing at Work. And I came to realize that more Americans get their health care, them and the individuals and their families, in the workplace than they do for Medicaid and Medicare put together. And so if you're going to affect meaningful change at scale, it's the only way you can do it. So we set up this Wellbeing at Work, worked with Mayor Adams at the time, and the goal was to bring together hundreds of companies, multinational companies, and with the intention of articulating best practices. And everybody learns from each other, and we all get better and from each other's circumstances and experience. And you build the impact of everybody kind of locking arms and making certain changes. And it's amazing. So, and everybody's kind of equally aligned and focused. But the unique difference also here, by the way, is an allocation of resources is not an expense. It's an investment. And that is a big, big difference, because isn't a business that I know today that has room for more expenses. Everybody's budgets are exhausted and they're expensed, and they're trying to figure out how to cut those numbers, but everybody has room for a good investment. And if you can show them how an allocation of a certain amount of funds will realize a return over a period of 5, 10, 20 times X over a period of time, everybody will find the resources to bring to bear.
The allocation of resources is not an expense, but an investment. So if the university CFO is listening, I just want to make sure that he notes that. My last question. So you mentioned your daughters helped you understand mental health and that needed a coalition. And one of my beliefs and hopes is the next generation is always better. Next generation is better. So tell us a little bit, what's your hope for the next generation who is inspired by you and wants to do what you've done? What do you hope that they do better and differently?
It's harder today. My daughter, I wish she was here today, who just joined our business recently, was a lawyer. And she kind of joined almost somewhat conditionally. And she said, I will do it, but I want to be able to work on one cause that's very personal to me. And I think my entire generation, and it's never been more relevant. And it's women's reproductive rights. And and it's something that it's this message that we put out there. 30, 40 years ago, 1989, I read an ad that women should have the right to be pregnant. Barefoot's another story. And I tried to do it in a light way, but I never really, dug in our heels and made the commitment. And it's a very hard because it is so polarizing, and social media is able to just shut you down, and you get all these bots out there that come at you from all these different angles. So we're trying to figure out how to do it in something that's very personal to her. But so what are the messages? What is it that you're prepared to, to put your shovel on the ground and make a commitment to, and how do you do it in a way that is respectful and appropriate and sincere? And the impact has to be real. It has to be quantifiable, it has to be transparent, and it has to be meaningful.
Let's open it up to the audience, either in the room or online. We have mics. Who would like to go first?
The first one's the hardest, and they get easy.
Right there in the back.
You mentioned that your work is never political, but often politicized. And I appreciate that sentiment. I think it's very true. I'm curious, considering that, how have you had to pivot and adapt since the new administration coming online and making much more of your work even more politicized?
It's hard as hell. I'm telling you, it's extreme on both sides of the aisle, and it's very hard to stay the course. And but a lot of it is changing vocabulary, and because a lot of this is there's these word searches and there's these mechanisms to attack alternative points of view, and so just figuring out how to stay the course and say what you feel and say it in as transparent a way as you can, but you got to pick the platform you use and the words you use, but we're gonna stay the course. But it's hard. It's much harder today, and with AI now, it's going to get even harder still, because there's more opportunities. With the internet and with social media, it was very concerning, because now all of a sudden you have there's everybody in the world is a competitor, and because everybody in the world has a point of view, and everybody can connect through the internet. And but I also came to realize everybody in the world is a potential customer, so it can work both ways. And if we set ourselves up properly and we set up the brand in the right way, and we find their voice. Social issues are very hard. They're very regional often. We were talking about guns a lot. I just always had a problem with guns. Maria's been a great influence for me. Her father was Mario Cuomo, and he was always also very strong on this one issue. And guns were built for the battlefield to kill as many people in a shorter period of time, not for self-defense, not for hunting, but they're all over. There's more of them than there are people. And it's an issue that I strongly believe in, but it's irrelevant in Japan. It's irrelevant in the Middle East. It's irrelevant in all these places in the world. But so you have to figure out how to regionalize and how to rationalize what you say and where you say it.
So we have a flood of questions from online. Let me just ask you an online question, and we'll go back to the room. It says, Mr. Cole, what advice would you give to students who want to use their future careers, be it in business, healthcare, or other fields, to advocate for better mental health, but are not sure where to start?
I think my business, the great thing about the fashion business, it's a lot of it is about being out in the world and being very present and aware of not just what's there, but what isn't. And with the so-called white space. So where is their opportunity, and how do you put your stamp on it? And there's a lot of it today, I think. So, and if you get ahead of the AI, which is ahead of AI, which is very hard, but if you can do things that you never could have before, and you can get there before others are. And I think you can. And I do think you need to connect the dots, and you need to speak to the whole person, and not just what's on their body, but who they are, what's on their mind. And if you can connect with them in a meaningful way, you'll have a more meaningful relationship.
Let's take the next question from the audience. Let's go right here. There's a mic coming just for people online.
Hi, we spoke before your lecture.
Thank you.
I think because we lived during your campaign and before it, and we were in the grassroots, And we were delivering Meals on Wheels and going to abandoned hotels. And no one was touching anyone. You couldn't go near anyone. Everyone was abandoning their loved ones, and everything was taboo. And the hurt and hate was so large, and yet people were in a coma with their eyes open. And what I think you are so iconic, why you're so iconic, is that you woke everybody up. That campaign, I remember seeing it everywhere, everywhere. And it was in your face, great. It was everybody wake up. And from my perspective, being a part of the gay community in the 80s and 90s and working with many, many, many organizations trying to save lives, you were a beacon of trust. And no one has done that. No one has been brave enough to take their brand and say, you can trust me, I understand who you are, and we're in this together. That campaign that said we all have AIDS makes me want to cry, because I remember when you did that.
Thank you.
Congratulations.
You know, the impetus for that campaign at the time was because we'd often sit and reflect on what's on people's minds and how, what is it we want to say, what is the best way to say it, and how do you say it, and what isn't being said, and you know what's on people's minds but not their lips. And so, and at that time, there was an analysis of HIV/AIDS stories on the cover of the New York Times, and it had gone to, it was a fraction. It was like 2% of what it had been the several years prior. It just was becoming irrelevant. But the amount of people that were being infected and dying as a result was growing exponentially. So how do you make it relevant, and how do you make it personal, and how do you connect with people? That was the challenge. So and because AIDS was everybody else's problem at the time, but how do you make it their problem? And so that was the challenge. So that was the task at hand. I'll tell you one quick story. I think this is in the movie, I'm not sure, but at that same objective, we did a series of ads which said, if your child had AIDS, you had more to worry about than clean socks. If your mother had AIDS, you had more to worry about than flowers on Mother's Day. And at the time, Clinton was the president, and if the president had AIDS, he'd have more to worry about than your vote. And if the Pope had AIDS, he'd have more to worry about than your prayers. And I showed the campaign to AmFARS before I was the chairman, and they said, great ad, but you can't run it. And this is a little too far, Ken. And especially, we'll compromise, you can run it, but you can't run the Pope. That's reasonable. So that afternoon, every year on World AIDS Day, December 1st, we'd have a press conference at the United Nations. And I would show the campaign that we were launching, and I showed the campaign. It was on bus sides in 17 cities. And it was a $2 million media grant that came from friends of ours. And I showed the press all the ads we were running. And at the end, I said, and here's the one we're not running. And I showed the Pope. And that was on the cover of every newspaper the next day. And with it came a letter from the Archdiocese by 12 o'clock that said, cease and desist letter, do not run that ad that we weren't going to run. And but that message resonated clearly, and I followed the script I agreed to follow.
That's brilliant. Let me tell you what we're not going to do as a school. Here's a question from online. So if you could wave a magic wand, change one thing about how we approach mental health in America, be it through policy, funding, education, or culture, what would it be?
You know, the biggest concern right now is that mental health care was not readily available. It was more available in some places where there was trained professionals, and there were other places where there weren't. But everything got democratized during COVID, and through online tools, people could access therapy and treatments. But today, a lot of that's turned into bots. And and they're not people. And young people today have declared their preference to talk to bots than to talk to people. They feel they're less likely to be judged, it's more likely to be anonymous, and they feel more comfortable talking to non-people. And it's a little scary, but that's a function of what where AI is taking us, and that's a concern. So and there are tools today to connect people in more meaningful ways. So one of the things we're doing at the Mental Health Coalition today, we also, by the way, have built a coalition of tech. I do feel there is no scalable solution without them at the table, and we have confidential agreements with Meta, with Google, with TikTok, with all of them, and they don't trust each other, but we're like the honest broker. And we are going to introduce the first set of online standards that they've agreed to hold themselves to, hopefully within 30 days. And we're going to try to figure out how to fold AI into it. But I think the opportunities are extraordinary. But the power of a coalition is amazing. I mean, what I've often said is it's the proverb, African proverb, which is alone you can go fast, together you go far. And I do believe the power of a coalition is very unique and very powerful.
One last question from the audience. There was one in the back, right there. Oh, okay. You go ahead.
Yeah, so my name is Isaac. I'm a student. I appreciate you being here, and I appreciate your impact in the fashion industry. My question is, at what point did you decide to embark on the public health sphere? Was there like an event in your life? Did you look at the data? Or what was it that made you move from the fashion industry into the public health sphere?
There was never a conscious effort to talk about public health. It was about talking about what was on people's minds and what really impacted people in more meaningfully than heel heights and hem lengths, as I was saying before. And it just happened to be collective health issues, also known as public health. So, but it wasn't a conscious effort to go there. But it's where I guess I am, and it's one that's been very fulfilling, very rewarding, and it makes everything I do more meaningful. And I do think that if I've always said when I talk to students, I talk to young people, I tell them that my journey was, I knew if I go to school, make a lot of money, I'll get a good job. Then one day I'll make a lot of money at work, and then I'll have money to give it away one day and make an impact. But I came to realize that if you make your service to the community part of what you do in the ordinary course, you can still be as successful, and it's so much more rewarding and fulfilling. So if you make it part of the journey rather than make it solely the destination, it's
Need to change your mic. There it is back. My last question. So we are unquestionably in a fraught moment. It's an uneasy time. I am in endless conversations within the academic world with partners about the unease about this moment. So in this moment, what gives you hope? What keeps you looking to tomorrow in this moment?
Look, I do think people are well-intended, and I just think this divisiveness is rooted in so much of it in social media, and everybody is uniquely informed, and everybody has their own points of view, and they're very much at odds, and these media platforms are rewarded by engagement, and the more they can keep you engaged, the more profitable it is for them, and the easiest way to keep them engaged, to keep you engaged, is to get you enraged, and so they're very good at it, and they feed you whatever it is going to get you there. And but I do think, first of all, I think if everybody could just trade algorithms for a week, we'd be in a lot better place. But that's not going to happen. And but I do think people are going to realize it, and I think we're going to get through some of this extremism politically. I think a lot of what happened Tuesday suggests that, and not as much in New York, but much in the rest of the country. And I do hope that we'll see next year a big change, and we'll have a more functional government for the people, by the people.
Thank you. Thank you for the inspiration. Thank you for my very comfortable shoes. I
was just wondering how many people would really want to be in your shoes.
But doesn't everybody? Please join me in saying thank you to Kenneth Cole.
Thank you.
I would like to invite Mary Mosbacher, who's co-chair of Make Way Our Students Initiative, to make some concluding remarks. Mary was the reason why we have Kenneth Cole with us today, and Mary, with her husband, Jim Mosbacher, has been a tremendous partner to this university.
Thank you, Mary.
It's an honor to have you here, Mary.
Well, it's my pleasure, and I wanted to say thank you to everyone who is here today. For those of you who don't know me, I am an alum of the Olin Business School and an active volunteer at the university. And it turns out that my husband, Jim, and I are co-producers of the documentary movie, A Man with Soul, The Impact of Kenneth Cole, which is going to be shown tonight at 7:30 at the St. Louis International Film Festival at the High Point. So it's really the reason that Dory and Kenneth are here in St. Louis. But it's an opportunity that was too hard to pass up. When I first saw the movie, and it's a fantastic movie. As you've heard, it tells Kenneth's story of how he built the company, but why he got involved in social causes. It gives you a lot more of what we've covered here today. After watching the movie as a business leader, my first reaction was that every executive should see the film because it positions marketing and business very differently than what we learned as MBA students years ago. I couldn't help but draw a connection to the Olin Business School and the opportunity to somehow weave Kenneth's story and the movie in a case study. So I picked up the phone and called Dean Mike Mazzio and said, what do you think about this idea? Of course, then I thought about our involvement with the Gephardt Institute and the St. Louis Fellows Program. And as Stephanie alluded to, Gephardt instills an awareness of civic responsibility and getting involved in the community with students from across the university, challenging them to be change makers. I saw a connection there too. And so if you think about all the change that has come about from the marketing that Kenneth has been able to so effectively deliver, I reached out to Stephanie and said, what do you think about this idea? And then I started having conversations with Dean Galea. I met him at a breakfast meeting a couple of months ago. And of course, his expertise in social causes of health and mental health and trauma, it all complemented what was happening around here. And of course, you tie that into our medical school here at the university. And I thought, imagine if we could get Dean Galea and Kenneth Cole together, what a great discussion we would have. And think about the impact growing even further and further. It would be an amazing discussion. And I hope you all agree with me that it has been an amazing discussion. The stars aligned. Kenneth and Dory came to St. Louis. This event began to take shape, and it really was truly amazing. We've heard great dialogue today. I hope all of our minds have been opened and enriched, and that you are all leaving here today with enough curiosity that you have an understanding of issues surrounding the mental health and the stigma around mental health, and what we can do individually to remove that stigma, and that when we do react, now we're taking the first step toward improving public health. I should mention that Dory and Kenneth are staying around the university. They're going to be addressing students through the Gephardt Institute tomorrow morning. They actually are going to have the students have already seen the movie, so they're going to be asking a little bit more of Kenneth to embellish on that one. And then all of you have an opportunity, because the university is going to be holding a private showing of A Man with Soul on November 17th, as Stephanie mentioned. Those of you in the audience have this card with the QR code on it. You can get more information on that one. But it will eventually hit streaming services, and I hope all of you are intrigued enough to watch this movie from start to finish. So I'm going to close by saying thank you again. again to Kenneth and Dory for being with us this afternoon. Thank you, Dean Galea, for hosting such a great discussion on mental health. And thank all of you in the audience and those who are on Zoom for participating. Enjoy your evening.